Representative Park Cannon is a Georgia state representative, one of 2 openly queer lawmakers in the Georgia Assembly, and its youngest. She represents House District 58, which encompasses a diverse cross-section of Atlanta. The Democratic lawmaker recently made national headlines when she was unlawfully arrested and removed from the Georgia Capitol after she knocked on the door to the Republican governor's office during his signing of SB 202, a restrictive law that limits voting rights in that state. Republicans in Georgia rushed the bill through both chambers of the legislature a few hours before he signed it into the law. It has been harshly criticized nationwide for disenfranchising Black voters and is being challenged in court and is being dubbed Jim Crow 2.0. Representative Cannon champions a range of social justice causes, and her legislative efforts focus on education, jobs, and healthcare. She seeks to stop the erosion of affordability for the basic needs, which she believes are the foundation of social stability. She also devotes her legislative work to protecting Georgia's most vulnerable citizens, women, children, the elderly, and the LGBTQ community. She has worked to address maternal mortality rates and the HIV epidemic in Georgia, housing affordability, and extending protections to victims of family violence and sexual assault. Representative Cannon attended the University of North Carolina at Chapel Hill, where she earned a Bachelor of Arts in Hispanic Linguistics and a Bachelor of Arts in Linguistics, and minored in Women's and Gender Studies. During her time at the UNC Chapel Hill, Representative Cannon was named Camões Award Recipient. How's that for Spanish? Did I do it? Okay. And inducted into the Order of the Old Well. She also participated in the Harvard Kennedy School of Government's Executive Education, State and Local Government Program, and she was named by the Harvard Kennedy School as the Bohnett LGBTQ Leaders Fellow and studied police accountability. You know, we talk policy all the time, that it crosses these P's. I told y'all I'm struggling with these P's today. Representative Cannon has been honored for her service to numerous organizations, including SisterSong, the Georgia Legislative Black Caucus, NOBEL Women, the League of Women Voters, the National Black Caucus of State Legislators, and the Atlanta NAACP. She was named a CALS Fellow and Henry Toll Fellow by the Council of State Governments and participated in the Atlanta Regional Commission's Leadership Institution. Ladies and gentlemen, I introduce to you Representative Park Cannon.
Hey everyone. I am so excited to be with you. You know, in Georgia, we use gender-neutral terms without even realizing it. So as much as I've already said hello to you, I just want to give you a sweet hello from the South, which generally goes like, hey, y'all. And I want to encourage you, even though you're not in the South, to use the term y'all, because it's an example of how you can use gender-neutral language that's also a little bit culturally rich. And that's a lot of what I try to do as a sitting lawmaker in Georgia. I do sit as the youngest lawmaker. I do sit as the lawmaker that the state capital's district resides in. But I'm also very excited to share that I am one of about 115 legislators who are actually going to return to the state capitol next session. You see, Georgia, this cycle, has had the largest turnover of lawmakers in its history. We had over 55 legislators not run for office again this year. And what does that really mean to me or to other elected officials or to people that are in your positions in the state of Georgia? That means that it's time to shake it up. That means that it's time for knocking on some doors and getting in some good trouble. Because actually, there are new people filling the seats. And so I want to remind you that it's not necessarily about the election per se, but it's about the newness that can come from these seats and how you can become proximate to the people in these seats because they simply need the information that you have. Now, what's some of that information that you have that us as lawmakers need? It's really unbiased information, facts, and statistics. Not a policy paper written by someone who works in our office or who lobbies for an agency, but actual data from your organizations and your businesses are what help incoming legislators not become indoctrinated into a certain type of legislating, but actually getting down to the good information. And I want to share with you some of the things that we've done in Georgia that even though some of my colleagues have considered and have said to the press and the media, they thought I was the annoying millennial in the room, but these bills actually got signed because they were equitable policies that addressed the different isms. They were trauma-informed policies that spoke to people's lived experiences, and they dealt with these issues that happen around what we kind of call cognitive dissonance, when there's this idea that maybe you are impacted by something, but you don't know how to name it, and therefore you might try to stop it. So I want to start by talking about people living with HIV. I have people on my staff who are living with HIV, and some who have taken medicine so their viral loads have gotten low enough that they technically do not have to disclose that they're living with HIV. You see, they've taken medicine called post-exposure prophylaxis, or ART, antiretroviral therapy. You might see ads on TV about this pharmaceutical product. And what I want to share about this type of pharmaceutical product is that the policies that need to be in place to back up that product even being on the market have to be pushed by agencies like yourselves and elected officials like myself. Because otherwise, stigma continues to creep in. So what does this look like? This looks like I went to the website that was actually created by an organization funded by the Center for Disease Control and Prevention, located in Atlanta. It's called AMFAR. You might know about AMFAR if you're in the public health industry. They were compiling data in Scott County, where Pence was in power, about what happened when there was an outbreak of HIV in Scott County. Now, you might know and think about a political conversation that could start on this. Who is this living with HIV? Why is it spreading? How is it happening? Well, a lot of the ways that it was actually happening did not have to do with the stigmatizing factors that are generally put out, like sexual orientation or gender identity. It was actually right in lockstep with pharmaceutical medicine being given out at doctors' offices for pain. People were using opioids and were injecting opioids and then sharing needles. And so this outbreak actually had nothing to do with stigmatizing people of color or people living in poverty or affected by poverty, but it actually had to do with a medically created issue. So AMFAR starts following this, and they start tracking the most vulnerable counties across the United States, of which Georgia had 5. 2 of those counties were urban counties. The county I represent, Fulton, the largest one, and the second largest one, DeKalb. But then it also had some very rural counties on the border of Tennessee. So I went to the speaker And I started to talk to him about how do we address HIV from a perspective that does not stigmatize, but actually controls for this just being a medical experience. And we were able to put together a pilot program, a $390,000 pilot program for 3 years that county health agencies, whether it's a community service board, depending on if the county is smaller, or if it's actually a county-funded health commission, to be able to receive funding from the state to do this pilot program. So we put in 3 rural counties and 2 urban counties. This way, and we'll be finally getting our report back at the end of this year in December, this way we're able to actually talk about HIV in a room and in a situation where it can become polarizing. It can become controversial. I could become very intense on the issue because I have people in my office living with HIV, and I have people in my community that I represent who live with HIV. Or I could help everyone in the room to see this as a policy that impacts everyone in an equitable way. Now, it was not easy. I will be very clear that there were many lawmakers who decided to vote against it, and that was their prerogative. But by that point, it had been a bipartisan piece of legislation that could be talked to from a medical perspective. And at the end of the day, the stigmatizing legislators, those who would come to me and say, well, Park, I went to my county and we don't have the AIDS in our district. I wouldn't even have to go into that type of back and forth. I could really just go back to the medical pieces. Now, we additionally started to see that people living with HIV or people who were taking this medication through this county program and therefore not contracting HIV, that they were still dealing with social stigma. The social stigma of if you possibly are at risk of living with HIV, should you have to disclose that to someone? And what types of people should you have to disclose that to? Medical providers, intimate partners, your employer, your child's school, if you're volunteering. What kind of areas is this necessary? And what type of areas is this just stigma creeping on in again? So this year, we worked to pass a policy through the Senate, and it had to be sponsored by someone who did not look like me or have the closeness to the issue as my office. But we had to start to actually talk about what is the point of disclosing your HIV status if your viral load is so low that you can't transmit it? What is the real reason? And many lawmakers had to realize that this was affecting their communities too, rural communities who were living through the opioid epidemic, who were injecting pain medicine or other medicines and were sharing needles. Would they need to disclose that if they were going to volunteer at their child's school? No, but in law, it said that. So we needed to address some of these pieces that could be stigmatized, but were really just about updating laws. For that reason, I want to remind you about whatever version of the Code Revision Committee that your state has. I serve on our Code Revision Committee, and it's ultimately going back and fixing typos. Now, I think that my linguistics degree helped me to look in the fine lines between a shall and a may in public policy and see how that can make a big difference, but also to use policymaking and small committees like the Code Revision Committee to affect typos. So we went in and we affected the typo of AIDS in school curriculum. You see, it was being shared in K through 12 that students needed to learn about AIDS. But scientifically, how do you learn about AIDS without learning about HIV? Because HIV is the virus that, if untreated or unable to be cured, actually leads to the acquired immunodeficiency syndrome, AIDS. So that was a typo, really, that lawmakers could either stigmatize and decide they didn't want to change, or they could just go ahead and make the change on. Now, I love this type of lawmaking and this type of policy making because it controls or allows for the actions to happen without the politics in the way. You see, we realized that we needed to go back in after doing these other two pieces and actually direct the Department of Public Health to change their protocols as it relates to testing for HIV. We were able to realize that not only did they need to test for HIV, but they needed to be able to provide some sort of option for people at risk of HIV. They needed to expose and let people know that PrEP exists, that PEP exists, and that ART exists. But as much as it seems like in Atlanta and in Fulton County that we were doing it, across the state in rural counties where stigma can creep in on these issues, pregnant people going there, having their results read to them, whether they're positive, living with HIV or not, but not being given anything, not being afforded any further information to take back to their communities. So instead of having to actually pass the piece of legislation that we wrote in my office to change the HIV testing protocols across the state of Georgia, the health committee chair supported the legislation and directed the state agency just to do so when they were going to print their next 400 pages of operating protocols to edit and to put in what was in the law. I see this as an opportunity for, even if your lawmaker, the person who represents your area, does not have the political okay to pass the things that you are asking them to be more creative, to think a little bit deeper about how to get it done and not to ask for credit. Now, this was difficult. I want to talk about the chamber that I serve in. It is a majority of the opposite aisle commission that we serve in. And unfortunately, we don't get to choose our committees. We are appointed to our committees. So as much as I work in education as a preschool educator, that does not mean that I am going to be on K through 12 education. Instead, I'm put on other committees like the insurance committee, of which when I became a lawmaker, I felt like I didn't know enough about. How can I serve and deal with issues related to health insurance, car insurance, life insurance, disability, if I've never worked in those areas? And I quickly had to learn that even though there is the stigma that some lobbyists might be paid for and bought by and therefore are not to be trusted, that's actually not the truth. You can receive information from people like we do every day on Facebook, on ads, on TV, and take what we need from that and leave the rest. So I've started to let people know that even if there is support given to me by a lobbyist, that does not mean that I'm blindly going to vote for them or for their issue. And it's really important that incoming lawmakers understand that, regardless of if it's a school board or if it's a state house or senate. And I saw this really play out on a bill that mattered so much to me. You see, we had this terrible incident of a hate crime happen in Georgia that you might be familiar with. His name is Ahmaud Arbery, and he was running in a rural county in Georgia. He was running like he always does for exercise, and he wound up murdered. We went to find out, as the Legislative Black Caucus, how did this happen? How did months and months go by without this actually making the news or even being reported to the GBI, the Georgia Bureau of Investigation? Well, you see, there were elected officials at the local level who were working on saying what they wanted to say happened. They wanted to say that, he shouldn't have been, that his toenails were dirty. They were focused on all of these different areas, except for the fact that it was a hate crime. The words that were uttered and the actions that were made or a hate crime. But in Georgia, we had no policies as it relates to hate crimes. It had been such a political issue over the years that we couldn't get it across the aisle. But this issue took it so that not only were we able to get race and religion included into an anti-hate crime bill, but we could also get the LGBTQ community included in this. It provided status recognition for the offenses of hate for a number of groups. And even though there were lobbyists that had been completely on opposite sides of the issue over the years, they were able to finally come together and to see that it was time. And so you're wondering, well, what made the difference? What was it that really changed? Was it the people in office? Was it the people who were working in the offices? Was it the testimony that was happening by his family? And it really wasn't that. It was really about deciding to do the right thing from the local level up. And that takes a lot of courage. If you're in a rural area or in a small county or city, you know how divisive it can be to be the lone vote or to decide that you're going to go an opposite way. And so there were a lot of private engagements that had to take place where people had to start telling the truth on what was happening in their agencies. And I can understand how that can be challenging or nerve-wracking if your job is already overseen by the state government or you're a part of an agency. But on issues such as this, I beg that you understand the importance. I beg that you come together and you find out ways to tell the truth about what is happening in your areas. Because perhaps there can be other policies that your state needs to get passed, like our hate crime bill in Georgia, that you can get passed. We had to see that even though we had passed this hate crime bill, there was more work that needed to be done on what happens when hate is not necessarily done outside of your home or in your community, but inside your home. What happens if you're living with someone and you're having abuse happen in your home? What happens if you're renting? Your name is on a lease with someone. And if you break that lease, you're going to have to pay exorbitant amounts of money, or you're going to have to lose an exorbitant amount of money. You could be taken to court in the state of Georgia for this type of action. And we started to see that the hate that was happening, it was looking like domestic violence. Now, many of you, I'm sure, have been impacted. The statistics show that as many as 1 out of 3 of us are impacted by domestic violence in the United States. And it's why I'm wearing purple today as we move through Domestic Violence Awareness Month. But we started to see that we needed to get the real estate agent selling and the realtor who's representing the clients to come to a similar place, to realize that if there is domestic violence happening in the home, there should be the ability within the leases, written into these leases, that you can break that lease. Now, this was a lot of work because the hate that happens in the home is so covert sometimes and so covered up and then multiplied by agencies. Maybe you didn't call the police and file a police report because you were concerned that someone might be taken off. Or maybe when you went to the health agency and you were found to now have an STI and you were trying to do contact tracing and partner tracing, but you couldn't contact that person because of the domestic violence issues that you had going on. How could we get this passed? How could we get these two disparate sides to see the issue? We actually had to bring families impacted, and we had to bring the LGBTQ community forward. We had to make it really clear that this is an issue that is not necessarily about sex or about gender or about sexual orientation, but it's about those who are most marginalized and impacted by agencies invisibilizing them. And this was an example of invisible domestic violence being perpetuated by the state. Now, that was a lot to get through. It was a lot of conversation to have with legislators of my chamber, many who are happily married, many who have lived their lives working in agencies, many who are attorneys, and who care about protecting people so long as though they don't have to say things like queer or lesbian relationship or gay. And so I took on that mantle. They worked on certain parts of getting the attorneys and the realtors together, and I worked on bringing the queer community to the Capitol. Now, many folks might be asking, what does queer mean? I want to just put it out there. It is a term that really has been reclaimed. I'm one of the people who is proud to reclaim the term queer. You see, when I ran for office in 2016, I was 24 years old, and I had recently just come out to my family. I think that it was the Women in Gender Studies courses that really helped me to find myself. But when I would go to communities and start to use the term queer, people would question it and question whether they could echo it. And it made sense why. Because queer used to be a noun. You see, it was actually a pejorative noun, a noun that was used as a derogatory term or to hurt or offend someone. But these days, it's actually been reclaimed as an adjective, and an adjective that's very expansive. So you could say they're a queer person. This is a queer community. It's more like an umbrella term of the way to address people. It allows for people's sexual orientation, which could be, lesbian or gay, gender identity, which could be male or female, as well as if they're cis or transgender to be included. Cis meaning same. You identify with the same gender, male or female, that you were born with, or trans, the change. You identify with a changed gender from what you were born as. And in a state like Georgia, having this conversation about queerness is very difficult. It can become stigmatizing. In fact, there are legislators who intentionally put policies to stop trans people from access to basic services like education and healthcare. And this year, we did see a bill in Georgia get passed, a bill that says that if you are not living as the gender that's on your birth certificate, you cannot participate in sports. Now, as the youngest lawmaker in Georgia, the person who's been in high school the most recent, in college the most recent, this really impacted me. And I felt intense about this conversation at the state capitol. I still remember this bill being pushed through committee and being passed onto the House floor and being talked about as an issue where there can be cognitive dissonance. And there was another piece of legislation that went tangential to it that says that divisive concepts cannot be taught in schools in Georgia. Those divisive concepts being race, gender, being transgender, sexual orientation. So we requested as lawmakers meetings with the agencies that would be tasked with putting these laws into effect. And they very clearly said to us, they felt like they had some ways to kind of get around stigmatizing children and hurting children and not allowing for them to move through life as they need to. But at the same time, their funding comes from the state or comes from these lawmakers. So they were going to go ahead and follow these policies. So right now in Georgia, when we head back into legislative session, we're trying to figure out a way to deal with this issue. And hopefully we will have some new lawmakers in place, which is why I started with talking about why it is so important that when lawmakers enter a space, that they are met with facts and statistics from your organizations and your agencies, not from the political ideologies that may come from their communities or fellow lawmakers. And as we're looking at these policies and these isms that are coming up, racism, sexism, homophobia, we're starting to also have to look internal at our own elected bodies. You see, in Georgia, we've had some issues with lawmakers perpetuating violence at the state capitol and lawmakers doing things that were inappropriate. So we had a new sexual assault training that all legislators had to undergo. And as we underwent this, we started to realize that the training that had been written was exclusive of the LGBTQ community. So how can you ask me, one of two openly queer lawmakers, to follow this policy that does not actually include us? This is why I do believe that the conversation on representation mattering is so important. Not that I go every day to the state capitol with a rainbow shirt or a rainbow pin on, but because I'm really thinking about deeply, how do these policies impact queer folks at the state capitol? This year, we started to look at mental health in Georgia, and we started to talk about mental health from a trauma-informed perspective. I was really proud that there was bipartisan work done on this issue and that we were finally able to get parity. This idea that if you go to the doctor for a cough and that's paid for, the same way if you go to your therapist for an appointment, that should be paid for. This idea of parity is something similar to equality. This community that has been mostly clamoring for equality has been the LGBTQ community. And talking about marriage equality, the importance of being able to live their lives in ways that were similar to others through equality. We had to start talking about parity in a way that helped not only therapists and mental health providers be seen and be paid for the work that they do, but also for community members who are needing services to have that paid for without having to go to the insurance commissioner and file a case and wait for that to finally come through. We had so many cases that had been moving through our insurance commission office that even the insurance commissioner felt it was important to move on this issue. So for the first time, starting July 1 of this year, we're able to have mental health parity in Georgia. And I really hope that, if nothing more, throughout this pandemic, we've all seen the impact of social isolation on each of us. Maybe sometimes we're more tense, maybe we're more aggressive, maybe we actually are more relaxed, not having to go into the workplace and be able to see our therapists at home. All of these different areas, these are the facts that lawmakers are looking for to be able to put together policies like mental health parity. We started to see that this mental health conversation was affecting our law enforcement and the police that were going out to do their jobs, but were being called to scenes where they really were not needed. Instead, someone who could respond to mental health issues could respond. This idea of a co-responder, to be riding along with them or to have their own agency. So what we did in District 58 3 years ago was we started a pilot program in 3 neighborhoods in the district that would allow for pre-arrest diversion. I'm sure many people have heard about this as a buzzword, as this idea that if someone is facing arrest, they can be diverted to a different type of program. Maybe they're having a mental health outbreak. They could be sent somewhere to help them address that. Maybe it's really just they're effectuating a crime of poverty. Maybe they were stealing something to get something to eat for their kids. Maybe they just needed actually a guaranteed income program. And so as we started getting the data from this agency that was doing the pre-arrest diversion, we started to see that many of the people who were in the program were also transgender and also openly queer. So we were able to use these facts that were not stigmatizing, again, from a county-run pilot program to take it statewide. I thought that it was not going to get passed. I thought that, this legislation, they knew that it was me and that they were not going to pass this bill. But actually what happened was sheriffs from around the state started coming and saying that they did not even have enough staff to be going out on these mental health calls. They themselves wanted help in dealing with this because their budgets were being cut. Their budgets were already pretty low. They were trying to hire more people, but the salaries aren't high enough. People just after the pandemic were not coming into work. So they too we're open to this type of pre-arrest diversion program going statewide. So much so that we have a few $1 million allocated for this program in 2023, and we'll be getting some reports later at the end of the year. And I recommend that this idea of diverting people from the carceral system is so important to folks like you who are attending this summit on poverty. Poverty can look so many different ways, regardless of how you dress it up. It's at the basic core level about human rights and restoring people's ability to claim their basic human rights by not putting them into a system that further takes that away. With our co-responder program, we did have to deal with the political conversation about defunding the police. How could lawmakers that were similarly saying defund the police also put money towards putting mental health providers with the police? We had to start to make it very clear that as much as that was a marketing tactic, it really meant reallocate resources so that police are used for the reasons that they are most helpful. And we started to see that we could put some of the money that was being diverted and reallocated from police budgets into a new call center. So now in the state of Georgia, we have a new number. It's 811. You can call it if you're having a mental health outbreak. I believe that this issue has been one that's been coming for a long time because of things like United Way. We had a 211 call center for as long as possible. And it really was intaking most of the folks living through poverty and asking for mental health and economic resources. But we needed a state-funded agency so that these calls could be routed in the correct way and so that people would receive what they actually needed to receive. I'm excited about this new phone number because we do think that we'll be receiving more information, but the only way that we can get this number even out is by organizations and agencies in our state, like yourselves, that actually say, yes, we do trust this agency. This is not the police. This is a way for you to possibly get some mental health resources, 3 therapy sessions paid for, to be able to get your bipolar medication paid for, to be able to help you get transportation for your kids to school so you can get to work. And it's really exciting to see that even though this started off in a conversation that was riddled with a lot of political back and forth, that we were able to get it done. I hope that I'm giving you some ideas of things that you can work on here in your state, but also want to put it under this umbrella of a term of reproductive justice. You see, when I ran for office, people started to ask me, what's your platform? And I had to resist, the shiny things, saying healthcare, education, transportation. I chose reproductive justice. I chose reproductive justice because it's this idea that there are reproductive rights, those that are put into law, and then there's reproductive health, the actual services that you receive. But there's things in the middle that don't get covered by any agency, like the child care to be able to go to a health appointment or transportation to get to the health appointment. And for us, this idea of reproductive justice broadened beyond a conversation about one medical experience. It started to help us talk about uterine fibroids and how the Insurance Commission office could go after insurance companies that were only doing the most maximally invasive procedure to deal with fibroids, a hysterectomy, taking your entire reproductive health organs instead of doing a small incision and helping to embolize. We started to see that reproductive justice came up in conversations about federal funding for highways. In Atlanta, there are certain highways where it always backs up. It's called the Grady Curve. Well, we really realized that that was an area. The cross street over the highway is Martin Luther King Jr. And so if you have, been in any communities or had this conversation about what do most MLK Jr. drives look like, what kind of communities are they normally in? Well, actually, we saw that this was an area where back in the 60s when our highway was created, that area was considered not economically prosperous enough. So go ahead and just cut the highway there and push it over the community and push communities to the side. Reproductive justice allowed for me to not just blankly as a lawmaker sign this letter of support to say, yes, we need more federal funding to address our highway backups, but actually to talk about the root causes of why this happened and why if we do it again without addressing those issues, without actually giving people better access to public transportation, giving people access to microtransit and things of the such, then we're just recreating the same issue. Reproductive justice for me as a lawmaker has given me air in a room that seemed as though it was trying to suffocate. I do believe that many more lawmakers can think about reproductive justice and learn more about it by following the organization SisterSong, an organization that actually coined this term back in 1994. SisterSong today actually is still in the news as yesterday. Their lawsuit actually went public and they had their hearing. The lawsuit was SisterSong versus Kemp, which was the lawsuit to defeat and go up against the abortion ban in Georgia. Now, this is a big topic, I understand, but I want to bring it to you from a perspective of reproductive justice. For someone who becomes pregnant, has that child, and they live in a community where they're not safe. They're shot by the police, they're gunned down in their community, they don't have access to basic health care services. The argument here is that reproductive justice understands all of that and restores the right to choice. The choice that begins when someone becomes pregnant. So SisterSong versus Kemp, this lawsuit had its hearing yesterday and it's continuing today. And ultimately it's talking about what happens when the state gets to make that choice. Now we know that the Supreme Court has made its decision as it relates to Roe versus Wade. But for us in the reproductive justice community, we say Roe versus Wade is the floor. And reproductive justice is the actual ceiling. Actually, where we're trying to get to, where people have access to the choices that they need. And as a lawmaker, I can't help but have gone down to the well and spoke against this bill and helped put together this lawsuit because there are some simple typos in the bill and pieces that the Code Revision Committee that I sit on should have looked at. One example is, if you give personhood, what happens if someone is riding in an HOV lane with no one else in their car? Should they receive a ticket or should they be okay? These types of conversations about child support. When does child support start? Does it start in the womb? And who does that impact the most? So reproductive justice doesn't situate us against each other in a conversation. It actually begs and asks the questions that need to be asked and possibly not controlled by the state. I beg that you look into reproductive justice on all of these issues and really think about the pillars that uphold it. Bodily autonomy, the ability to choose, parenting in safe communities. These are the things that we want for rural communities and urban communities alike. Now, I want to just remind folks that at the end of the day, we do have to address the issues related to birthing people dying. Many people call it maternal mortality, the actual death, or maternal morbidity, the continued comorbidities, the things that come together to create a pipeline for negative health experiences like hypertension, high blood pressure, much stress. How does this get controlled by the state? Especially if the states are then determining that a choice has been made on when pregnancy can be terminated. So the same lawmakers that I am staunchly on the opposite side of as it relates to the right to choose, through reproductive justice, we were able to expand postpartum Medicaid. I want to tell you about that fight. It started off by us saying, we have data that shows that within 1 year of giving birth, people are dying. Most of these times, it's not a car accident. It's not just, something that is pregnancy related. This is associated with the pregnancy. This is pregnancy associated. And so as we started to look into this 1 year postpartum, we started to see where can people get access to health services for that 1 year, or mental health services, or transportation services, or educational opportunities. And it all led back to the Department of Public Health and the Department of Community Affairs and the Department of Community Health. Actually giving people access to Medicaid in a state that has not expanded Medicaid to this day is really difficult in Georgia because it does have an income gap and it does go into certain communities. We overlapped all that data and it came out very plain. Black women were dying 3 times the rate of their Caucasian counterparts in Georgia. And not only did Georgia have the first or second worst maternal mortality outbreak in the United States, but our numbers were worse than international countries. And I'm not here to stigmatize countries that are not the United States. I'm proud to be in coalition with global leaders who believe in reproductive justice and global leaders of the global South. But it is a lot to say that a state like Georgia that seems to care about choice making and pregnancy was only giving 6 weeks of postpartum Medicaid care. 6 weeks. So your pregnancy can't be terminated after 6 weeks. And once you deliver, you only have 6 weeks of health care. The reproductive justice lawmakers on the opposite side of the aisle started to see that it wasn't adding up. They told me there wasn't enough money to do what my law said that we should do, which was give 1 year of postpartum access to Medicaid. So I settled. The first year, I settled for 6 months, and we watched people die throughout the pandemic that should have received those services. We petitioned the federal government, and they gave us some funding. They said anyone who is put onto the Medicaid rolls cannot be taken off throughout this pandemic. And that was huge. It was amazing for a state like Georgia for us. But what happened when that federal funding left? Georgia had to do it on its own. And I'm proud to say that this year we got the millions of dollars that we needed to expand Medicaid postpartum for 12 months. And for 1 year, we're gonna watch and see how the numbers come back. I hope that your state is able to make some of these policy changes as well and able to bring forth some of the change that's so necessary for us to even continue forward in communities. It's a lot to think about. I'm sure your agencies and your organizations and businesses are laser focused on certain policies that work or that don't work. And I understand that it might seem nerve-wracking to contact your legislator or contact your community leaders and talk further about this. But I do want to remind everyone that it is our constitutional job to respond to you. Not just because I'm a millennial who has a millennial staff and loves my phones and responds to emails. I shouldn't be the only one doing that. There should be lawmakers in every community around the United States who care about public engagement and who have types of meetings where you can bring your facts, and it doesn't have to be at the Capitol, and you can affect policy making. So I'm going to tell you how my office does it. It's called design thinking. This is out of the Stanford School of Design. You see this water bottle here. When they created it, they said they wanted something to hold water. And so they figured they needed it to be something that holds something and that doesn't have a hole at the bottom so the water can actually stay in. But then they decided that they wanted it to stand up and not be flat on the surface so that when the condensation drips, it doesn't make a pool all of a sudden. They realized that they needed to make it a clear label so that you could see through the water. You could see what was in it. All of this is by design thinking. Businesses and companies use this to make all of the items that we wear and work with today. It's this idea that you start off with an end user. And for me, that's my constituents. Folks from every different walk of life who I believe deserve reproductive justice. You take it through and you make a minimum viable product, an MVP, something that just doesn't have a hole in it at the bottom. And then you start to workshop and design think, why doesn't this work? How could this be better? And you're always testing it against your end users. So those year-end reports that you put together and you print 5,000 and they sit in your office, take them to the community. Take them to your lawmakers, because these are examples of the MVPs that we need to be able to serve our end users. I might not always have time to do a survey on what people think about my HIV bill and if it should go through committee or if I should just direct the agency to do it, but I have the data from AMFAR that shows that this is what could impact the policy. We have our design thinking sessions of my office in public places like libraries. We ask people to sign up just so that we know that we have enough refreshments for them, and we center it on an issue. And we work through an issue over and over. We ask interrogative questions, and we become very interactive with what happens. This is a series of why and how and when questions. These are the questions that lawmakers need access to. But we might not have time once we get in session and it's all cramped. This is awesome to do in the off season when we're out from the state capitol or when the commission is not meeting for a summer break, to pull together these design thinking sessions. Invite your community members to design thinking sessions that you create, or invite lawmakers to the design thinking sessions so that we don't have to feel like we have all the solutions or we're coming to the table, but that it's really an ideation process and it's really iterative. We found it to be very helpful, and it's how we've gotten every single one of these policies that I've shared with you today. For me, it's not about legislative accomplishments. As a young lawmaker in the minority, I do serve in leadership as the secretary, but as was said in my introduction, it does not afford me privilege, sometimes even from those who are sworn to protect me. You see, last year when they passed a voter suppression bill, a bill that was 2 pages on March 24th, and we woke up on March 25th, and it was 98 pages, and it changed every section of the voting code. It said that you couldn't give people food or water waiting in line or face a felony. It said that anyone can challenge anyone's voter registration, whether you know them or not, and you could do it in an unlimited number. And also that counties providing elections were no longer able to receive funding from non-governmental entities to actually run their elections. So small counties that needed masks, no longer able to receive that type of funding, no longer able to actually have Saturday voting because they didn't have enough money to pay their poll workers or to keep their lights on. When we saw that this bill was passing, we did everything we could on the House floor to stop it. We went over to the Senate when it passed, and we tried to stop it as well. And normally, a bill changing 96 pages worth and passing 2 chambers in one day is plenty enough. But we heard that the bill was being signed by the governor. Our chamber dismissed, and we went downstairs. I used my hand to knock on the governor's door because as the secretary of the House caucus, it's my job to be in the room when bills are signed, pens are given out, and if members of our House caucus are not able to attend, I'm the one to receive those pens. But instead of being entered, being opened the door, I was arrested. I was taken to jail. I was dragged out the state capitol, where I spent the possibility of 8 years in jail. Two felonies, one that would have been obstruction and one that would have been disrupting the General Assembly. I know that I will not be the last lawmaker who is arrested for standing up for the right to vote. And as much as it was never a part of my plan, I do want to encourage you about knocking. This idea that we keep knocking. There are always going to be doors of injustice, always, in your community, in the agencies that you work in. And even if you face penalty, possibly jail time, I encourage you to keep knocking, because I do believe that those doors of injustice will finally open. We have a little bit going on in Georgia right now, and I, can't not say it, but I've been told that the next time that I knock on the governor's door, that she will answer. And I'm pretty excited about that. So I thank you so much for having me today. I'm happy to answer any questions that you may have. Thank you.
Thank you. Please give Representative Cannon another round of applause.
Thank you. Thank you.
So, Representative Cannon, we have microphone runners at the back of the room that will field questions. Chantel, how much time do we have for questions? 10 minutes. 10 minutes. So does anyone have, how many runners do we have? Can you hold your mics up?
Yeah, they're right there.
All right. Are there questions from the audience? All right, here we go.
2 questions. What is the status of the felony charges against you? And what do you recommend we do with the racist politicians in Wisconsin?
Thank you for asking. The district attorney in Fulton County decided to dismiss my charges. So at this time, as a sitting lawmaker, I'm trying to figure out, how do I go back to the state capitol with the same Capitol Police who arrested me? What does that really look like? And so we're going to pursue some laws about that as well. So please stay tuned for what we'll be doing. And then as it relates to racism, I want to be really clear. Racism looks a lot of different ways in Wisconsin. It's against folks who are indigenous and native. It's against their languages and the ways in which they raise their communities. It also looks like black and white issues. From the things that I'm continuing to see, it's a lot like Georgia, very similar. But we, under this Bible Belt, we get all this attention. And sometimes those people are removed from office. There was a lawmaker who became increasingly Islamophobic, so much so that he went to a reality TV show and pretended to shoot and harm folks from Muslim communities. Now, he didn't know that he was on a prank show. He thought that they were applauding him for what he was doing and that he was going to be lauded for what he was doing. And he had many supporters back at home that thought it was quite hilarious. But at the end of the day, the speaker recommended that he be removed from office as well. And I was really proud of that moment of our speaker because they share many identities. I do think that as much as people in Native communities, indigenous communities who speak different languages, who are black and brown, how it is our mantle to continue to take up the issues of racism, it's even more so for folks who look like each other. And I'm proud of Speaker Ralston for doing that day. He stood up to a lot of folks. Now, I'm on the opposite side of our Secretary of State as well, but he did a good job of that too when it came to whether our election was rigged and stolen or not. And this idea of things being rigged and stolen, because all of a sudden now folks who have my skin tone are voting, are registered to vote, or if their vote is being challenged, their registration is being challenged, they're going to court, they're finding the information, they're re-registering. Oh, now this is voter fraud. And so our Secretary of State actually did a good job of standing up to the previous Commander-in-Chief on that. And I think that's an example of how we can move forward within our agencies for folks to really look around and to flex their equity muscle, I call it. You might not be necessarily lifting the big weight of the racism out of your agency, but you might flex a little bit and say, hey, that made me feel uncomfortable. Can you say what you meant by that? I had to learn, myself. I was such a truth teller when I first got to the state capitol. You said it, I told it. And I ended up running for the secretary of the caucus because now I just get to put it in the minutes. And so I recommend, too, some of those internal ways that we flex our equity muscle, we get it down on paper, we challenge it in small parts, and hopefully it has bigger impact. Thank you for the question.
Hi, my name is Dakota, and I'm here with Public Allies. My question, I wanted to touch on the lobbyist point you brought up before, and using their resources effectively. And while I agree short-term with what it is you said, how do you deal with the fact that as you become more integrated with these people and these policies and spaces, and those relationships are built, how do you long-term look to sort of avoid those influences over the ones of the community that you serve?
Mm-hmm. Absolutely. And I beg this question of my colleagues as well. But short and sweet is getting new lobbyists. At the state capitol in Georgia, there are 5 Black registered lobbyists out of thousands. So we actually had an intentional program in my office to cycle people through the internship and help them become lobbyists, help them pay the $125 to become a lobbyist. And whether they were a community lobbyist for the issues of Black lives or maternal mortality, or with an actual agency, simply creating representation within the lobbying community is the start. I mean, that's where we are in Georgia. We are at ground zero because it is an incredibly homogenous body of lobbyists who have, over the years, built in their structural power. And we're trying to meet that where it's at by adding new people to the lobbyist roles. I will also say, with lobbying, even though I did not have a title as a lobbyist, I was a community lobbyist. I'm realizing. I saw my lawmaker. She was doing a great job. I liked the things that she was doing. I would contact her and give her more facts and more data. And so this idea of community lobbyists that are not bought and paid for, they're not paying the chicken dinners, they're not taking you out for whining and dining, that is more impactful to me. I'm more prone to listen to community members than I am over the lobbyists that have been there for so many years. And the last thing I'll say on that is the pandemic really made a difference in Georgia lobbying. I'm not sure about Wisconsin, but ultimately, everyone was at home. You can't take me out for a chicken dinner. You can't invite me out to this place for wine. You have really no events for me to be at or to be seen at or to be, brought back to say, well, didn't you pledge and promise that you were going to follow this? And I'm happy about that. I'm really glad that many of those lobbyists have had to find better ways to engage with our communities and to engage with the issues that we want. And I'm hopeful that that will continue now that we're in this next part of the pandemic and through session. Mm-hmm.
Hello, my name is Billy. I have a question. So a few days ago, you had Justice Thomas and Senator Graham from South Carolina, not Georgia. How does this change what's going on with the probe in Fulton County with that decision?
Yeah, so our district attorney, the same district attorney who dismissed my charges, has been very valiant in deciding that she's going to go forward in her charges and subpoenaing and calling the former commander-in-chief. And she has received more death threats than I have. She has more security than I do. But the short and sweet of the conversation that her and I and our delegation has had about this entire probe has really been, how do we restore the possibility that people in power change facts to suit them at the end of the day? She is not afraid to show examples of that and to really bring that forth. And I'm proud of her. I'm also a little bit nervous because it can implicate other lawmakers and other people in powerful situations. So I'm hopeful that as people continue to run for office, continue to be a part of these probes and this very, very hot topic, that they too have a set of self-dignity, have a set of civility when they move into these positions. The increasing celebritydom as it relates to policymaking, I'm not interested in, and neither are Gen Z, the folks who are coming below us, after us. They're so sensitive to it that they'll even not vote if they feel like it is all about celebritydom. So that part has been interesting, and I'll just finish by saying at the same time, throughout all of this, our great Congressman John Lewis passed away. And there were many conversations about the Georgia State Capitol honoring him. Should we have a hallway? Should we have a statue? And Black Caucus members were putting this information forward, put together a bill, put together a commission, getting the money for it, and everything was halted because there was the request from the governor's office and from some of the powers that be to actually put one in for Clarence Thomas instead. And so right now in Georgia, we are hot and heavy trying to understand how that would impact what the district attorney is doing. Stay tuned is the best I can give you.
Hello. Just a comment, basically. As a former STC employee, I'm so proud of STC for bringing your voice to us. And as an openly gay man, I can tell you we are so very proud of you.
Thank you. You're so kind. Thank you.
My question, well, actually, I have two questions. The first question, you talked a little bit about how you could get bipartisan support for some of the things that are definitely reproductive justice aimed, and how you were able to kind of elaborate on the floor and the ceiling is reproductive justice. I'm wondering if you can elaborate a little bit on how people can do that on an interpersonal level, and how people are willing to vote against their own self-interest because they don't understand how reproductive justice is related to environmental, to all of these different things, all these different institutions. But people are still not aware that they actually do support reproductive justice, and they're willing to vote for candidates that do not. My second question is, what happens after reproductive justice? We break that ceiling, we get past it. What do we call it?
Ooh. The first one, so SisterSong, one of the ways that they do trainings, you can bring them out to your organization, and they will help to cycle you through a 101. But ultimately, I'll give you the starter. It starts with figuring out, what is your RJ story? What is your reproductive justice story? It can include a reproductive health experience, a reproductive rights experience, and some of the things in between there. So I started to go to lawmakers and ask them, what year were you born? And, they'll joke, whatever ageism joke they want to joke at that moment. And, let's say they say, 47 or 60. And I'll ask them, were Black people able to give birth in the hospital when you were born? And, they'll say, well, I don't really know. Not quite sure. Why are you asking? And so then I'll start to ask them, well, how were you born? What was your birth story? Were you born in a hospital or a birth center? And many lawmakers have disclosed to me that they were born at home because of the time between 47 and 60, even though Black folks couldn't give birth in hospitals in Georgia then, many rural communities, that was what they did. It was safe. It still is. And so I would be able to help them connect the issue of choice in birth. Home birth is, unfortunately, community midwives are illegal in the state of Georgia. And so we only have, professional midwives and nurse midwives where you have to go to additional schooling, $40,000. You have to take this big exam, books, all of this. But yet, the people who birthed some of these lawmakers helped to bring these people and also are still serving these communities are being penalized. It's helped me be able to talk about home birth and talk about why it's important that we have community midwives and doulas and lactation consultants that don't cost the IBCLC rate and things of the sort. It's been interesting, but I would say it starts with this conversation about what is your reproductive justice story and really helping people dig in. And SisterSong has an awesome set of questions that you can pick and choose from to help pull out where you're trying to pull out. Secondly, this idea of voting against your interest. We were, a lot of nonprofits, you can't do candidate-related advocacy. You can do issue advocacy. And so we would go to a lot of nonprofits and say, well, I understand that you might not be able to support my campaign for re-election, but can you vote for RJ? RJ is this genderqueer person who cares about police accountability. And they could actually start to get like, oh, that's actually kind of an interesting idea. Similar to, can you vote for environmental justice? Can you vote for EJ? Creating a space for nonprofits to engage in the situations around elections is still really important in places like Georgia, and I'm sure here too, because there are so many regulations and rules that would stop, and especially in Georgia with this new Senate Bill 202, a nonprofit that is a food pantry that just wanted to go and give out food and water in lines, now they can't. So we're trying to help them figure out ways too, but this idea of voting for RJ, we've been able to use it on the municipal level and the county level. We're using it for the insurance commissioner race. It's kind of, burgeoning and interesting. And then where do we go from reproductive justice? Y'all tell me, okay? I don't know, but I am proud that the organizations that are coming together are finally able to impact policymaking. For the first time in 2018, we heard presidential candidates use the term reproductive justice. They actually came to SisterSong first and started asking and talking and listening. And hopefully there's something even better than reproductive justice. But this idea that Roe fell and now what is really a big opportunity for our organizations to do trauma-informed practices, to really center people's lived experiences and to root out the isms. I'm excited about it.
Hi, my name is Star, and again, I work for the SDC for the Public Policy and Research. Hi, can you hear me better?
Yeah, it's perfect.
Okay, so you talked about HIV at the beginning, and I'm not sure how familiar you are with Wisconsin, but Wisconsin is ranked number 7 out of 100 other states for having the highest rates for STDs here in America. Based on the validity of those statistics, should mass testing be a protocol for individuals over the age of 18 to stop the spread, or would that be considered a human rights violation?
Interesting. Yeah, so there's also, this federal initiative right now, a 2022 and a 2040 and a 2050 goal on ending the HIV epidemic and other STIs that come with it. I guess my thought without more research on it is, if it's not imparted in a way that includes trauma-informed practices, then it could, add to different stigmatization. For example, in Fulton County, when our county was notified that monkeypox had come to Fulton County, Georgia, the first information that went out was about sexual orientation. And even though queer communities wanted resources to be able to stop the spread, they knew in themselves that they had not engaged in behaviors that were being purported as why monkeypox was spreading. So there are sometimes situations where outbreaks that are not related to sexuality or sexually transmitted diseases are purported as that, and then the stigma is dumped on top. And I think monkeypox was a great example of how communities had to push back and say, Representative Cannon, will you come out and do some polling with us? So we would go out in the neighborhoods and we would have an iPhone or iPad, and we would have questions like, did you know that monkeypox can be spread through physical contact? And they'd be like, yeah. And then we would include a few different types of physical contact, sharing a vape, trying on clothes at someone's house, going to a bathhouse, sex. People would only choose the last one, but the rest were inclusive too. And so I think that was an example of the importance of a trauma-informed lens, or a lens that was culturally competent and specific enough so that information was being given out. And so people weren't just feeling like, well, this is the new HIV, because it's not. It's absolutely not.
Thank you, everybody. Can you please give Representative Park
Thank you,
another round of
everyone.
applause?
Come visit
Thank you
me
so
in
much.
Atlanta.
Absolutely. Thank you so much.